Hi everyone, this is Dr. Rashmi here. Today we'll see what are the prerequisites for the natural conception. This is the basic requirement for any couple to conceive naturally. So there are only three prerequisites which are required for a natural conception. First and foremost, the male, that is the husband couple, he should have a normal semen parameters. What do I mean by normal semen parameters? The normal semen, the count, the quality, the volume, all this will be taken into consideration. So see, this is how it goes. We'll see how this is a normal semen analysis report where we'll see about the volume, the viscosity, any infections, any pustules or infections. But ideally, the two most important thing in the semen analysis is the count and the quality, quantity and the quality. According to WHO criteria, we take the normal count of anything above 15 million and the quality any normal sperms above 4. First and foremost, we have to rule out there is no male factor involved in it. Once the husband semen parameters is normal, then we look into the female factors. What are the normal female factors for natural conception? First and foremost, have a regular ovulatory cycles. Now, what do I mean by ovulatory cycles? The regular menstrual periods where the egg is released every month and it enters the fallopian tube and where it meets the sperm and becomes the embryo. So there should be regular release of egg from the ovum into the fallopian tube. This is a ovulatory cycle. Now, how do we know that it is a ovulatory cycle or anovulatory cycle? So ovulatory cycles, usually the female complains of slight pain during periods, that is the first and second day of a periods. It will be a little painful. Some people will experience mid-cycle pain, what we call it as during ovulation pain. It is at the mid-cycle of when the egg is about to rupture, that time they experience little pain and there will be change in the consistency of vaginal discharge. What do I mean by that? The vaginal discharge, it will become suddenly thin in body and liquefied. So that is the time where the ovulation is happening. And some people experience little rise in body temperature. They feel the warmth in the body. So all this indicates towards ovulatory cycles. Now, why am I stressing on ovulatory cycles is because some people without egg development also can have regular periods where the endometrium keeps shedding regular time, but it is not involved with the ovulation. So couples keep wondering what is this, we have a regular cycle but still we don't get pregnant, means we are not able to achieve pregnancy. Then we have to monitor by scan or by certain tests where we confirm whether ovulation is happening or not. Now, the third prerequisite, what is more important for natural conception is the tube, the fallopian tube, where we see here through the tube, the egg enters here and the sperm meets here. See, the sperm meets here and becomes a zygote, that is the embryo. So the tube has to be opened at the initial part and at the end. Now the initial part for the sperm to enter and the end part for the egg to enter, so that both the gamete can meet here and to form the embryo. Now, how do we do the tubal patency test? There are certain tests where we can look into for the tubal patency test. One is the X-ray like imprinting, what we call it as HSG. And the other one is directly go and visualize through laparoscopy that whether the tube is patent. We push the dye from here and see whether it is coming out through the tube. By that we can confirm that both the initial corner and the terminal end of the tube is open. So once all these tests has been evaluated and is found to be normal, then there is something called, apart from all these factors being normal, also there will be difficulty for the couples to conceive. That we term it as unexplained infertility, where we don't know what is the reason for infertility. Suppose if there are 100 couples, if 100 couples who are experiencing infertility, 30 will be, there will be some male factor associated with it, 30% there will be some female factor associated with it, and 40%, another rest 40%, we don't know the reason for being for not being having to get it checked.